Hello, dear friends. Today, we'll talk about skin papillomas, where they come from, and what you can do to cure them. Many of you think that papillomas are caused by papillomaviruses. Even some doctors think so. However, they are not. In fact, what we call papillomas are soft fibromas. The scientific term for this is acrochordin. These are round-shaped formations that hang on a thin stalk. Sometimes, some accumulate in one area of the body and have a characteristic unpleasant appearance. They can appear on the eyelids, neck, back, armpits, chest and thighs, any part of the body, and in the skin folds. Especially from these formations suffer people who are prone to excessive body weight. Of course, for the average person, all skin formations are indistinguishable. However, the formations we traditionally call papillomas, which are soft fibromas, differ from papillomavirus lesions. Papillomavirus lesions are warts. These warts can be on the genitals, acute candidal warts, or soles, palms, and knees, common warts. Theoretically, warts can occur on the scalp and other body parts, but they have a characteristic appearance, a broad base and surface like a cauliflower. Soft fibromas have a smooth surface and, as I said, hang on a thin stalk. In addition to these two growths, there is seborrheic keratosis. Seborrheic keratosis can also be mistaken for a small wart or soft fibroma. You may not even be able to tell them apart at first. Seborrheic keratosis is similar to a rough mole, which also looks like a cauliflower. And, of course, all these formations can be confused with ordinary moles. In rare cases, it can be either a manifestation of melanoma or other malignant skin neoplasms. Fortunately, almost all skin formations we perceive as papillomas are these soft fibromas. In other words, they are benign neoplasms that do not cause complications. Their only drawback is their unpleasant cosmetic effect. They can be traumatized by shaving. I will still call soft fibromas papillomas because everyone is used to it. From what do papillomas arise? The exact cause is not established, but it is believed that it is one of the manifestations of aging skin. It is considered that in some areas, the skin loses some concentration of elastin and collagen fibers. In places where it is exposed to friction, a certain deformation occurs. This deformation turns into a hanging formation under the influence of further friction. Papillomas are very common. 46% of the world's population have them, and by the age of 70, 59% have them. Men and women are affected by them to the same extent. It is believed that there is a factor that can contribute to the growth of papillomas. This factor is hormonal changes. For example, they can occur in pregnancy in women, when there are high levels of progesterone, or in acromegaly, when there is an excess of growth hormone. There is also a clear link between the occurrence of papillomas and obesity, type 2 diabetes, insulin resistance, impaired lipid metabolism, and high blood pressure. In other words, what we call metabolic syndrome. What role does the human papillomavirus play in the growth of papillomas? Removed papillomas have been the subject of many studies that involve screening for viruses. In some studies, they were not found at all. About 50% of people have human papillomaviruses. So human papillomaviruses do not cause papillomas to grow and cause papillomas, but they can complicate their condition. It means that papillomas can constantly get traumatized. As a result, new human papillomaviruses, which are abundant in the environment, about 150 species and even more, can get into the small cracks. As a result, the soft fibroma becomes populated by viruses. How did they behave further? Sometimes they do not manifest themselves in any way. Sometimes they can contribute to the progression of the papilloma. But I repeat once again, we cannot be sure that papillomas are caused by the human papillomavirus. There is no evidence for this. It is not difficult to diagnose papillomas. One thing is important, whether the formations on the skin are papillomas. Therefore, it is necessary to visit either a family doctor who understands skin diseases or a dermatologist to determine exactly what the formations are, papillomas, warts, or just keratoma. There are so many options for their treatment. In principle, you can leave them untreated because they rarely cause complications and are purely cosmetic. If you still want to get rid of papillomas, there are many ways to treat them. Probably start with the simplest. Normalize your diet and motor activity. If you have metabolic syndrome or insulin resistance, you should get treatment and return yourself to a healthy state. If you're overweight, you need to lose it. Even this can lead to favorable consequences. The skin can begin to cleanse. If this does not help, or you do not want to do it, many medications can be bought without a doctor's prescription. Most often, these are preparations of salicylic acid. They can be successfully used both for papillomas and warts. Naturally, if we're talking about the eyelids, then the treatment should be prescribed only by a qualified ophthalmologist. Everything that I'm describing now, treatment, drugs, is not a recommendation to deal with papillomas. That is just general information. Before you consider removing papillomas, you should visit a doctor anyway. Thus, you will be able to understand whether you can remove papillomas or whether it is better to trust a specialist. If we're talking about real papillomas, so-called benign formations, and soft fibromas, drugs that cause local necrosis may be suitable. For example, chemicals that can dissolve the upper layers of the skin. Salicylic acid, for example, has such properties. Various versions of salicylic acid, as creams and solutions, from 4 to 50%, are freely available in pharmacies. These medications do not require prescriptions. In principle, people can apply them themselves. After a while, these preparations help well. Solutions of trichloroacetic acid and nitric acid work very well locally. I will not give specific names of medications not to be reproached in advertising. Even tying off can be used to remove hanging papillomas, but this should only be done by a doctor. If not tied well enough, necrosis may be incomplete, and inflammation of the surrounding tissue may occur. If local methods cannot cure hanging papillomas, surgical excision can be applied. That is, from the usual scalpel, ending with laser, cryodestruction, radio wave destruction, and so on. Now, there are a lot of methods, and all of them are effective. They can be done on an outpatient basis, painlessly, anesthetized with lidocaine. The only thing is not to wait until there are a lot of papillomas. If you notice a tendency to increase their number, it is better to remove them quickly. Otherwise, it will take longer to treat. Removing a papilloma does not mean many new papillomas will reappear in the same place after its disappearance. In fact, it doesn't. It all depends on the factors that contributed to the initial growth of those papillomas. If you eliminate, as I said above, the underlying causes of papillomas, you can succeed in fighting them. In this same video, let's focus on the treatment of acute condylomas, or genital warts, as well as common warts that are caused by the human papillomavirus. All these formations are similar to each other. In addition to surgical treatment and various methods of local destruction, such as trichloroacetic acid or nitric acid, also apply medications that belong to the category of immunomodulators. For example, there is such a substance, imiquimod. Cream with this substance is applied to acute condylomas or warts. Imiquimod has immunostimulating effects, so the body begins to cope with neoplasms. In some cases, chemotherapy medications are used, which include 5-fluorouracil. Ointment with this substance is also applied to the wart, and after a certain period of time, this wart will also fall off. Retinoids can be effective enough for topical treatment. These are representatives of a class of medications similar to vitamin A. They are usually prescribed for the treatment of acne. Topical application for acute condylomas and warts can also help. In cases where a person has a lowered immune system, he may develop a lot of warts and acute condylomas, which cannot be removed in any way. Then, they can apply systemic treatment. It can be immunostimulants, interferon alpha-2b preparations, cimetidine, a drug that is usually used to reduce gastric acidity, or cidofovir, a drug that is used to treat cytomegalovirus infection. By the way, There are alternative methods of treatment that work very well, such as hypnosis. It is often very applicable in children and demonstrates more than 50% of positive results. Applying raw garlic cloves to warts and acute condylomas for a day can also help to remove them. Celandine juice and propolis are also effective means. That's it. Thank you very much for your attention. Remember that in most cases, what we perceive as skin papillomas are harmless soft fibromas, which cannot be infected and infect anyone. They cause only a cosmetic defect by their appearance. Always for you, Dr. PopMed.